breakthroughs. Brought to you by Lucid Quest. Prenatal pesticide exposure has been found to harm child brain development. Researchers studying chlorpyrifos exposure in the womb identified lasting brain abnormalities and reduced motor skills in children. In a study of 270 kids aged 6 to 14, brain scans and behavioral tests revealed structural and metabolic disruptions proportional to exposure. Although banned for residential use, chlorpyrifos remains widespread in agriculture. Experts call for stronger protections, especially for pregnant women in farming communities. High-intensity yoga has been identified as the most effective exercise for improving sleep. A review of 30 clinical trials found that practicing high-intensity yoga twice a week produced greater sleep improvements than other forms of exercise. Walking ranked second, followed by resistance training. Authors note that results may vary by population, but overall, exercise remains a powerful tool for better sleep. A major new analysis confirms there is no safe level of alcohol consumption. Previous research that suggested moderate drinking could be beneficial was found to be based on flawed methodology. Even light drinking increases risks for cancer and cardiovascular disease. Health authorities are adjusting their guidelines, with the World Health Organization stating no amount is safe. Scientists have discovered a protein that drives age-related memory decline. The protein FTL1 was identified as a key factor in hippocampal aging and cognitive decline. Elevated FTL1 disrupts neural connections, while reducing it restored memory function in mice. Boosting metabolism also countered its harmful effects, suggesting promising drug targets. These findings open the door to therapies aimed at reversing memory loss. Vitamin D deficiency remains widespread and is tied to multiple health risks. About 35% of U.S. adults are deficient, with many more not reaching optimal levels. Vitamin D supports bone strength, immune function, heart health, mood, and muscle function. Deficiency is linked to fractures, depression, and increased risk of chronic disease. Best sources include sunlight, fatty fish, liver, fortified foods, and supplements. New evidence suggests cannabis smoke may increase cancer risks. Cannabis smoke carries carcinogens similar to tobacco smoke and weakens the lungs' natural defenses. It also alters immune signaling and activates pathways such as EGFR that are linked to cancer development. While some studies connect heavy use with cancer, evidence is still mixed, and further research is needed to balance the risks against cannabis's medical benefits. The potential eye health risks of GLP-1 drugs, including semaglutide, are being reassessed. Large studies show no overall increase in diabetic retinopathy among users. However, there may be a weak link to a rare condition known as non-arteritic anterior ischemic optic neuropathy, though the absolute risk remains extremely low. Experts recommend baseline and routine eye exams for patients using GLP-1 therapies. Overall, the benefits for diabetes and weight management continue to outweigh the risks. The United States is facing a mortality crisis, hitting millennials and Gen Z the hardest. Americans aged 25 to 44 are dying at much higher rates than peers in other wealthy nations. Key drivers include drug overdoses, motor vehicle crashes, alcohol, homicide, and chronic disease. Researchers cite inequality, weak healthcare access, and social instability as major underlying causes. A gene has been linked to chronic pain, offering new treatment possibilities. Scientists identified SLC4504 as a regulator of polyamine transport in nerve cells, with certain variants more common among chronic pain sufferers. This discovery opens the path to therapies targeting both genetic and diet-related mechanisms. Finally, cancer nerve damage has been found to drive resistance to immunotherapy. Tumors damage the protective coverings of nerves, triggering chronic inflammation and exhausting immune cells. This cycle reduces the effectiveness of treatment. Researchers identified pathways that could be targeted to restore immune response, underscoring the importance of cancer neuroscience in future therapy design. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for expert